Hello everyone, I am Padmaja and I am Neha and we welcome you all to our channel. Today I am looking forward to talk about one of the social issues, that is teen depression and suicide. Let's get started. The mental and emotional disorder is known as teen depression. Teen depression is a serious mental health problem that causes a persistent feeling of sadness and loss of interest in activities. It affects how the teenager thinks, feels, and behaves, and it can cause emotional, functional, and physical problems. Teen depression isn't a weakness or something that can be overcome with willpower. It can have serious consequences and requires long term treatment. Let's see some news or cases regarding teen depression and suicide. Arjun Bharadwaj, a 24-year-old management student who committed suicide by jumping out of a 19th floor hotel room in Mumbai. He committed suicide due to repeated failure in exams. A 16-year-old TikTok artist and dancer Sia Kakkar reportedly committed suicide by hanging herself at her residence in New Delhi on Thursday, June 25, 2020. The reason behind her death remains unknown. Bengaluru student Ankita's parent couldn't understand why she didn't want to attend school despite getting good grades. The 11-year-old girl skipped her meals and had angry outbursts. Her worried parents took her to a therapist. After several sessions, she told that she was a victim of cyberbullying. A class 9 student of a Delhi school committed suicide. Parents of the 15-year-old have blamed the school authorities for harassing their daughter. The girl apparently failed in 2 exams. Her parents urged that it was a deliberate move by the teachers to fail the girl. They said that she complained about them. Noida police probing the case. Factors that may increase a teen's risk for depression is the risk factors, and this includes a family crisis such as death or divorce, bullying, living in a violent household, having no social or emotional support, having a difficult time with their sexual orientation in the case of teens who are lesbian, gay, bisexual, transgender, queer, intersex, asexual, and more. Family history of suicide, alcohol and other substance use disorders, low self esteem such as obesity, peer problems, etc. Low self esteem is when someone feels low about their abilities and limitations. Having a chronic illness, which means the condition that lasts 1 year or more and require ongoing medical attention, for example, heart disease, cancer, and etc. Exam stress or academic problems, or being the victim or witness of violence such as physical or sexual abuse. Kids with teen depression will have a noticeable change in their thinking and behavior. Teens with depression don't necessarily appear sad. Instead, irritability, anger, and nervousness may be the most prominent symptoms. Although depression can occur at any time in life, symptoms may be different between teens and adults. Some of these symptoms and signs are lack of hope, energy, or motivation, sleeping too little or too much, inability to concentrate and change in eating habits, withdrawal from friends and family, talking about death or suicide, use of alcohol or drugs, and social isolation. Loss of interest in activities usually enjoyed, feeling of sadness, anxiety, hopelessness, or worthlessness, self injurious behaviors such as cutting, burning, or suicidal attempts, showing changes in normal routine such as sleeping or eating, irritability or tearful, worsening school performance, ache and pain that don't go away even with treatment. These behaviors may be rare in adults but are more common in teens. Let's see what are the causes for teen depression and suicide. First is early childhood trauma. Traumatic events during childhood, such as physical or emotional abuse or loss of a parent, may cause changes in the brain that make a person more susceptible to depression. Second, traumatic life event, such as loss of a loved one or pet, divorce or remarriage, any event that causes distress or trauma, or even just a major change in lifestyle can trigger depression in a vulnerable individual. Third, social situation, family circumstances. Unfortunately, there are teens who live in difficult circumstances. Domestic violence, substance abuse, poverty, or other family issues can cause stress and contribute to depression in a teen. Fourth, inherited traits. Depression is more common in people whose blood relatives, such as a parent or grandparent, also have the condition. Fifth is abuse. Physical, sexual, or emotional abuse can make more vulnerable to depression later in life. Sixth is serious illnesses. Sometimes depression happens along with a major illness or may be triggered by another medical condition. So now, what is the treatment for this? Let's see. Depression will not go away on its own. Left untreated, depression can be very damaging and can result in suicidal ideation. If you suspect that a teen is depressed, it's important to open up a dialogue in an honest and non-judgmental way. You want to convey to a teen that you are there to help, no matter the triggers beneath the depression. So, how to communicate with a depressed teen? Listen more than you talk. Judging, criticizing, or trying to fix the problem with an endless list of practical solutions will only push a teen away. Depression is not a problem to be solved, it's a disease to be healed. One of the best things one can do is to listen to a teen and provide emotional support. Don't minimize. A teen's problem feel overwhelming to a teen. Resist to urge to gloss over troubling situations or say things like this will seem like no big deal when you're older. Meet a teen where he is today and acknowledge his feelings and stressors. Be persistent. If a teen is accustomed to hiding her emotions or problems, she might not open up during the first conversation. Talking about depression is not a one-time conversation. In fact, it can feel very overwhelming. Keep the door open and be present and available. Trust your instincts. If a teen denies a depressed mood, but your instincts tells you that something is not right, talk to a teen about getting additional support. The important thing is for a teen to have a trusted source to talk to during this time, and professional help can bridge the communication gap. How to seek treatment? There is no sure way to prevent depression. However, these strategies may help. Encourage a teen to, by talking to an adult you trust, not to isolate oneself, it makes depression worse. Adopt healthy habits. Manage stress and anxiety. Take steps to control stress. People should educate themselves on what this disorders looks like. Don't dismiss what you feel. Reach out for friendship and social support. Get treatment at the earliest sign of a problem. Maintain ongoing treatment if recommended. Trust in treatment. Lifestyle changes can help teens struggling with emotional issues, but it's not always enough. If a teen continues to struggle with symptoms of depression despite changes at home, Seek help as soon as possible. The following interventions can be helpful for your teen: physiotherapy, group therapy, family therapy, medical management. Some shocking stats regarding depression. Depression is the number one mental health disorder in the world for both adults and teens. Suicide is the third leading cause of death among 15 to 19-year-olds. India has the highest number of teenage suicide rates globally according to 2019 rate. 1 in 4 teenagers in India suffers from depression, and yet we keep pretending this is not happening in our own homes and schools. We have a population of around 135 crore, out of which 6.5% people are suffering from some form of mental illness. 6.5% is around 8.5 crore, and this is more than the total population of South Africa. It is the primary cause of suicide in teens, where there are 12 times more likely to attempt suicide. For every one suicide death in teens, there are 10 more attempts. Half of all mental health conditions start by the age of 14 years, and most cases are underdetected and untreated. Female teens develop depression twice as often than males. Abused and neglected teens are especially at risk. World Health Organization also estimates that about 7.5% Indians suffers from some mental disorder, and predicts that roughly 20% of India will suffer from mental illnesses. According to numbers, 56 million Indians suffer from depression, and another 38 million Indians suffer from anxiety disorders. Over 70% of teenagers do not receive treatment for depression. The numbers are staggering, but numbers do not show the suffering of young people. When you see these numbers, you think it is happening out there to somebody else, but it is happening in our schools and homes. Some of the important dates are World Mental Health Day, which is on 10th October. The overall objective of World Mental Health Day is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people worldwide. World Suicide Day is marked every year on September 10. It was first celebrated in 2003. This day aims to provide worldwide commitment and action to prevent suicide at any cost. The pandemic has increased anxiety and depression among a lot of people all over the world. National Depression Awareness Day, which is marked on 8th October. This initiative helps to raise awareness about one of the most common mental health disorder. Raising awareness about depression is vital for ending stigmas surrounding it and other mental health disorders. So what we learn from this? We learn that depression is a silent crisis, but it need not be. Increased awareness with the development of needed mental health programs can reach teens who need help. Working with social media can reach teens who may be suffering in silence. Collaboration with teen support groups and faith organizations can create safe havens for teens. Though a coordinated effort on the part of public and private industry, government agencies, concerned family, friends, schools, and healthcare professionals, we can make a difference in preventing suicide and saving lives. For a difference to occur, people need to acknowledge the severity of teen depression and the significant risk of suicide. Teens need attention to make them feel valued, accepted, and secure in the knowledge that people are there to help them. Remember, The generation is the most connected through social media and the internet, but the sense of disconnection is highest.